So, whenever you're ready.
Okay, thank you. Hi, my name is Peggy Copeland. I am 49 years old, and I have suffered my whole life with severe migraines. I got diagnosed when I was 5 years old with severe migraines, debilitating, violent migraines, all through childhood. Shortly thereafter, around age 12, I was diagnosed with severe scoliosis. And from that point, tried everything regarding dealing with my scoliosis and migraines, and not having a whole lot of luck. So I've been a chronic pain sufferer really my whole life. At age 17, I had spinal fusion. Over 10 levels of my spine are fused, with a massive rib resection on my right side to deal with and stop the curvature of my spine. And from that point, about 6 months after my surgery at age 17, I started getting a really unusual type of migraine. It was related to my scoliosis, but my new fixed position that the surgery put me in. And from that, I would twist based on stress or sleeping wrong, or maybe not getting enough rest, or just having a really busy day, a lot of physical activity. My body would twist in such a way that I would get this debilitating migraine that would take me out of commission. It would be a vomiting migraine. All the visual things have to just go to a dark room, and those migraines could last 1 to 3 days. Severe, lock me in a room, almost as bad as when I was a kid, but in some ways a lot worse, because the recovery was much worse. And then I'd take about, 3 days to get well. So this was just a constant cycle. And I'm a busy professional, married. I work for higher ed, education. I work with students, demanding type of job, and I couldn't keep up with my life, and I wasn't able to really enjoy having fun, doing fun things, extracurricular activities, because I was always either getting a migraine, experience a migraine, or recovering from a migraine. And I tried many different treatment modalities, different medications, migraine medications, different traditional chiropractic, physical therapy, every kind of massage therapy, acupressure, acupuncture, craniosacral work, working out, trying one type of workout, trying a different type of diet, changing my diet I don't know how many different times over my adult years, and always coming up short. I'd get a little bit of relief for a little while. Maybe I could get maybe a few weeks without a migraine, but then there I would be again, and I was just stuck in the cycle. And, I talked with, my neurologist, my spinal surgeons, everyone, as to what can I do? What can I do to make this better? Quality of life with each decade was getting lower, and I was experiencing more and more migraines, more and more just physical trauma. And I just happened to stumble upon Dr. Koblish advertisement last summer, so I'm coming up on a year anniversary. This is, where are we right now? May of 2022, and so I started, I think, June of 2021, and I am in a place right now where I can go an entire month without a migraine. I can go an entire 4 weeks, actually 5 weeks, probably even 6 weeks from last adjustment to this one, where I don't suffer. I have a whole new lease on life. I'm able to kind of just, I feel like I've been remade and reinvented in a lot of ways. And I was just talking with Dr. Koblish about it today, as far as, I still have that trauma, the fear of that pain coming back that's just going to lock me away in a room for a few days. But it's getting more and more distant. And as she reminds me, my body is capable of healing, even though I've got this scoliosis fusion where it's sticking me and keeping me in a certain position. But the rest of me and my nervous system and my spinal column and all of the nerves can learn to be better and be more readily aligned with how I should naturally be. And when I started learning, I guess maybe about 6 months ago, that I can heal, it's really hard to describe, because when you've suffered with such chronic pain as I have, really 44 years solid, because I started getting migraines when I was 5, it's still a lot for me to take in. It's still a lot for me to recognize that I don't have to be imprisoned anymore, and I can plan on taking up some new hobbies. I can plan on spending time with friends. I can plan to spend, time enjoying my life and, taking a trip with my husband, or, walking my dog longer than I normally would, because so many little triggers would throw me off. So I'm in a whole new place right now, and I'm profoundly grateful. I'm overwhelmed. It's kind of, I almost want to tear up, just tears of joy. But I do recall the first day I came in to meet Dr. Koblish. It was really the first time I kind of met with someone who said, there's a different way to do this. There's a different way to approach your treatment. You have different options that you've not seen before. And when we looked at the 3D scan of my spine, and looking at what my cervical system was doing, it was stunning to see the misalignment that I'd been living with, and that was not being found, was not being tracked, was not being identified through any other modality. No MRIs were showing it, no x-rays were showing it, palpitation from other chiropractors and other physical therapists. I was coming up short constantly. And when Dr. Koblish showed me that those vertebrae, the way my C1, C2 were lined up, I was 13 degrees out of whack, out of where I should be. And she told me people with around 5 degrees of rotation are in severe, often debilitating pain. And here I was running around the last however many years of my life, probably decades, with a 13 degree or better misalignment. And I wept. I openly wept, knowing and hearing for the first time that there's something else that hasn't been explored, and that I have an opportunity to actually heal and not be sick. And just being able to embrace that I have a whole new lease on life. I don't have to be sick. I don't have to suffer. I'm sitting here right now and I actually have zero pain. That's just something that's not been part of my world, not part of my life. There's always been something that's hurting. And now that I can actually share with you and share with anybody who's watching this, that something that was absolutely hidden has been brought to the light, and it's been addressed, and it's being addressed, and I'm getting stronger and better every month. And on the wall in Dr. Koblish's office, it says, expect miracles. And I was just sharing with Dr. Koblish, I couldn't even see that given the pain and the defeat and really the depression I walked into this office with. I couldn't even see those words, and they're big. They're on the wall. But then about, I guess, 4 or 5 weeks in, I was able to see it, because the veil for me and the severe pain started lifting. And I believe in miracles. I believe that this treatment has been that miracle for me, and so I'm eternally grateful to Dr. Koblish and the staff here, who's so lovely and supportive. And I am just so grateful that with my scoliotic body and the things that I struggle with, it doesn't have to define me anymore. And my upper cervical is healing and becoming very healthy, which means my whole nervous system, my anxiety levels are way down, because severe pain all the time. It's just kind of hard not to feel anxious. So I feel good, and I'm excited for what the future holds. And being without pain it's phenomenal. It's just truly amazing. So thank you. Thanks for the opportunity to share.